ਸਾਡੇ ਨਾਲ ਅੱਜ ਸ਼ੋਅ 'ਚ ਮੌਜੂਦ ਹੈ ਗ੍ਰਾਹਮ ਮੈਕਗ੍ਰੈਗਰ ਜਿਹੜੇ ਕਿ ਐਮਪੀਪੀ ਹੈ ਬਰੈਂਪਟਨ ਨਾਰਥ ਤੋਂ। ਸੋ ਜਿਹੜੇ ਹੈਲਥ ਮਿਨਿਸਟਰ ਹੈ ਡਿਪਟੀ ਪ੍ਰੀਮੀਅਰ ਸਿਲਵੀਆ ਜੋਨਸ, ਉਹਨਾਂ ਨੇ ਅਨਾਉਂਸਮੈਂਟ ਕੀਤੀ ਹੈ ਲੌਂਗ ਟਰਮ ਹੈਲਥ ਕੇਅਰ ਪਲਾਨ ਨੂੰ ਲੈ ਕੇ। ਕੀ ਉਹ ਸਾਰੀ ਅਨਾਉਂਸਮੈਂਟ ਔਰ ਜਿਹੜੀ ਸਰਵਿਸ ਓਨਟਾਰੀਓ ਦੀ ਗੱਲ ਕਰਾਂਗੇ, ਸਰਵਿਸ ਓਨਟਾਰੀਓ ਦੇ ਰੂਫ ਦੇ ਅੰਡਰ ਕਾਫੀ ਸਰਵਿਸਿਜ਼ ਸਿੰਗਲ ਅਪਾਇੰਟਮੈਂਟ 'ਚ ਅਸੀਂ ਕਰ ਸਕਦੇ ਹਾਂ, ਉਹਦੇ ਤੇ ਵੀ ਜਾਣਕਾਰੀ ਲਵਾਂਗੇ। ਗ੍ਰਾਹਮ, ਵੈਲਕਮ ਟੂ ਪ੍ਰਾਈਮ ਏਸ਼ੀਆ।
Oh, thank you, Nitin, and hello to all the viewers of Prime Asia. Thanks for having me on the show.
Graham, what is the announcement of Sylvia Jones about the long-term healthcare plan for Ontario? What are the major highlights points into that announcement?
Yeah, absolutely. And thanks for the question. We had the health minister really released our plan called Your Health, connecting a plan for connected care, which is really our roadmap on what we want to achieve in the healthcare space. Now, minupata, twanupata, sara nupata, that what we're doing, the status quo in healthcare, just simply isn't working. If we continue to go down the path of continuing to try the same approach, we're going to continue to get the same results. And your viewers know that the healthcare system is in a crisis right now. We need to take bold, decisive action to fix that, and that's really what this plan's about. So it's a three-pillared approach that we're looking at. One is about the right care at the right place. The second pillar is really about speeding up that wait time, getting you care faster. And then the third pillar is all about hiring more healthcare workers. Now, I'm happy to expand on the three pillars in a follow-up question.
So, Graham, if you can expand on the emergency wait times in our healthcare system, in the emergency hospitals. So, wait time is very long. So, in the second pillar, as you said, that it can be handled, it can be addressed, it is already addressed. So, what is the solution for that?
Yeah, so a few things. One, obviously expanding hospitals, and we've got about 50 new major hospital projects that are happening across Ontario, including in Brampton, including one in Mississauga as well. But we're also looking at what is happening in a hospital that doesn't need to happen in the hospital. So you would have seen earlier, we announced our intentions around moving some of the more less critical surgeries out into community clinics. So for instance, we have cataract surgeries, 14,000 cataract surgeries per year happening this year. That represent about 25% of the wait list is going to be happening in community clinics. Eventually, we're going to be rolling that program out as well for hip surgeries, knee surgeries, that kind of thing. Getting people out of the hospital, getting them into the clinic. Now, we've also been looking at making sure that you're getting the right care in the right place, because the healthcare system should work for the patient. And we all know right now that is not the case. And one of the changes that we've made, for instance, is really common sense. It's around your local pharmacy. We took 13 kind of common ailments, so things like pink eye, hemorrhoids, UTIs, that now your pharmacist can actually prescribe medication for. So instead of you going to the doctor's office or maybe going to an urgent care center or hospital, you go right to your community pharmacist, the same place where you're going to be obviously able to get the medication from. And you're kind of able to do a one-stop shop for a lot of these common ailments that, a pharmacist is more than qualified to do. But, the other kind of really key part of all this is our plan around hiring more healthcare workers. Since Premier Ford took office in 2018, we've expanded our healthcare workforce by 60,000 new nurses and over 8,000 new physicians. But we know that that's not keeping up, and we know that we have more work to do. So we're doing it in a few ways. We've got a bill going forward right now to establish as of right rules in Ontario. So if you're a nurse in Quebec or you're a nurse in New Brunswick, you'll be able to, if we pass the bill, you'll be able to be a nurse in Ontario as of right. Now, I also think we should expand that. And, if you're a nurse in India, or if you're a nurse in the Philippines or a nurse in the Brazil, there's no reason it should take you 4 years and thousands of dollars to become a nurse here in Ontario. So we've also been working with the Ontario College of Nurses, where they're speeding up the recognition of their credentials, where we're going to have 5,000 more internationally educated nurses as well. Of course, dovetailed in with expansions of medical schools. We have a medical school coming in Brampton. Obviously, your viewers would have heard about that as well. This is all part of our plan to get better healthcare for you and really make government work for you. We need to make sure, governments are supposed to serve the people, not the other way around. And we're really looking at government services, making that more convenient so that you're able to get healthcare when you need it, how you want it.
Graham, seems that Ontario government is serious about the healthcare actions because recently they took, as you discussed, that from the medical school, from the pharmacy's decision, from the surgeries part of decision, everything is going to help the Ontarians definitely, and these are all welcome steps by the Ontario government. So, if I ask you to elaborate the three pillars which Sylvia Jones today mentioned in her press conference, so can you elaborate those three pillars?
Yeah, absolutely. So the first pillar is the right care in the right place.
Hmm.
And this takes some of the action, like the pharmacist action that we did, but also a lot of the community supports we've been putting in for mental health. Yeah, before Premier Ford got elected, government never really got their heads around the fact that mental health was the crisis that we have today. And we've put the roadmap to wellness, which is supported by a $3.8 billion investment in healthcare to really expand support for people who need it. And then around that right care in the right place, we also have our Ontario health teams that are going to be integrating between different healthcare providers to make sure that medical records follow the patient wherever they go. So you don't have a separate medical record at your doctor's office and then another one at the hospital and another at a long-term care home. It's all going to be integrated now. The data sharing is going to be integrated amongst the teams. Pillar two is about faster access to care. And that's what we talk about when we say cutting the wait times. Hip, knee, cataract surgeries are all about 50% of the surgery backlog that we have in Ontario today. Getting a lot of those out of the hospital into the community clinics is going to severely, one, make it more convenient, obviously, to access this healthcare, but also speed up the ability and your ability to do that. We've also been working on some plans to have, 911 paramedics, first responders be able to do more procedures out at the site of the emergency rather than having to bring people back to the hospital. So if a paramedic is able to perform the operation, they're having the license to do that. And we're rolling that out across the province. And then our third pillar is about hiring more healthcare workers and really bringing the healthcare workforce into the 21st century. That's a few things. That's the as of right rules around nursing that I talked about. You can be a New Brunswick nurse, come be a nurse in Ontario. That's the international nurses that we're talking about. But that's also doing our best around promoting people to get into the healthcare field. So, we have the Learn and Stay grant, which we're expanding, which, the government basically pays for the tuition of an aspiring nurse, provided that they go serve in an underserved part of the province. So these type of programs that we're doing, like I said, we've hired 60,000 new nurses, 8,000 more doctors. We need thousands and thousands more. And we're really taking some transformative action, really bold and innovative action to make sure that Ontario has the healthcare workers that we need.
Graham, Premier Ford said if you need a nurse, registered nurse online anytime 24/7 a day, and you can call 811, Health 811. So
That's right.
elaborating into that also, Service Ontario, he also mentioned that the 55 kind of services can be provided under one roof in Service Ontario office, and we can do single appointment, we can make use of those services. And the most importantly, now Ontarians, they don't have to go to the city hall to get a marriage license. If you can highlight these few points also and
Yeah,
let us know.
absolutely. And it's the same way that we're looking at healthcare. It's the same way we're looking at all services across the government. Now, Service Ontario, the way that the government handles your documents and the administrative part really needs to get more customer service oriented. And it makes no sense for you to have one appointment to get your driver's license and another appointment to do your health card and another appointment for a marriage license. We've moved that marriage license into Service Ontario, so you don't have to do it in City Hall. But we've also brought forward a plan around online booking of appointments. So, the same way that you would book an appointment online, to talk to a specialist or get a massage or get a haircut or anything like that. You're going to be able to do that at Service Ontario as well. We're really bringing Service Ontario into the digital age, into the 21st century. The other really good news that happened when we had Premier Ford at Service Ontario was we're rolling out a virtual appointment process. Now, it's for accessibility. It's only going to be for seniors over the age of 80. And obviously, the seniors probably have a young person with them helping them with the computer. But they're going to be able to actually do their appointments and with Service Ontario online. So we're very excited about expanding that as well, because, you see it, I see it. The lineup at Service Ontario sometimes is even worse than the fee. It's like you don't even mind paying the fee, but you don't want to wait for 2 hours in line or have a lineup around the block. So the more we can do to get a better customer service experience for residents, this is a top priority for us in Ontario, and we're just trying to treat the residents the way that we would want to be treated.
Graham, thank you very much for all this information. And in the end, in case you want to give the message in Punjabi to Bramptonians, to Ontarians.
Look, Minu pata, tonu pata, sare nu pata. Ontario has a lot of challenges right now. We have a healthcare challenge. We have an economic challenge. We have housing challenges. But I just want you to know, asi Brampton Medical School banavage, asi tackling the healthcare crisis banavage. And investing in the future so that the bache growing up now will be able to get very good jobs. That's the key priority for us right now. So thank you to the community and all the viewers for their support. I know that it's a challenging time in Ontario, but I want to let you know that myself, my PC colleagues, Premier Ford, our whole team, we really have your back, and we're making some changes that are going to be good for you and your family.
Thank you, Graham. Thank you very much for coming and discussing all these important issues. Thank you.
Thank you, Nitin.
Thank you.